Hello and welcome back to the programme today. And I'm joined now by Andi Skilton, who's the Senior Manager for Public Engagement and Involvement at National Institute for Health Research in England. And I met Andi earlier in the year, last year sometime, and we were talking about a great tool that NIHR have developed that I felt was maybe of real value to us in Wales. And Andy's going to share what that tool is, how it's used, and the invitation from me, as you heard earlier, is to think about how could you locally in an individual study incorporate that. And if you're interested to know more, then we'll carry on the conversation. I'm really keen we give it a go at piloting this, but it requires really local commitment to do that as the study processes happen. So I'm not going to say any more. I'm going to hand over to Andi, who's going to tell us all about it, and then we can pick it up from there. Thanks, Andi.
Hi everybody, thank you so much for inviting me. I'm really excited that there's interest in PRES here in Wales, so let me give a bit of an introduction. So yes, as Nikki said, I'm Andi Skilton, I'm Senior Manager for Public Engagement and Involvement. I work for the NIHR Clinical Research Network. So if you're not familiar with that, we are the bit of NIHR that supports the delivery of research in different health and care settings in England. So studies that meet certain criteria can be adopted to our national portfolio, and they get additional help and support to run to time and target. That's the role that we play. And one of the services you could say that we offer studies on our portfolio is the chance to take part in PRES, Participant in Research Experience Survey. It's exactly what it says on the tin. It's a national survey we run every year. Try to understand what the experience of participants in NIHR supported studies is, and from that insight we try to use this to inform our continuous improvement programme, so both at a local level in GP surgeries, in trusts, and those places where we deliver research, but also to understand how protocols can be improved for research and feed that back to study teams and sponsors and to the wider partners and networks that we work with to help ensure that overall people who are taking part in research, volunteering their time to these important studies, have a much better improved experience overall. So I'm going to take you through now an introduction to the PRES as it currently stands. It's been a project we've been developing over the last sort of 3 to 4 years. This is the latest iteration of it. And as we go, I'll pose some questions, which would be great if people could have a think about and reflect on as I talk, and put those in the chat, and maybe we can have a chat about them in a bit more detail in the Q&A at the end. So my first question, really, as I talk through the study itself, would be lovely to hear from you your reflections about potential obstacles or opportunities that you can see for delivering PRES in your own research work. So this is PRES. So PRES is composed of essentially 7 critical sort of questions for us, quantitative questions, where we ask people about different aspects of the research process, everything from that initial engagement where you get your patient information sheet through to your relationship with the research team as the study's developed, and even as far as to ask people if they know how they'll get the results of the research they took part in, and whether they would take part in research again. So we really want to understand that full pull-through process for people taking part in research. We also give people the opportunity to feedback on both the positives and the challenges of their research experience in their own words in these qualitative questions. And that's really where some of the meat and the real richness comes from in people's feedback. And then we ask some general questions of people around how long they've been in research, is their first study, and that just gives us a little context to those experiences. Can we determine whether people more experienced of research will generally have a better experience or a worse experience? These are the kinds of questions we're trying to answer with PRES. PRES is also, there are 4 national versions of PRES at the moment. We have the adult version for over 16s, and then we have age adapted versions with the same questions for children of 0 to 6, 7 to 11 and 12 to 15. And these are running in some of our regional networks. We also have, in some of our areas, we're running demographic questions and collecting contact information. These are optional at the moment and just reflect some of the local programs and advancements that have been made. So we take a really pragmatic approach to PRES. It's a really flexible and adaptable system that can be rolled out in a variety of different settings across the country. So the methodology of PRES, we've tried to put in place, particularly for this year just gone, more of a robust methodology for PRES, so we can really strengthen the data. And that was really the ask that we had from the Department of Health and Social Care over the last 12 months, was to really, how can we get the most out of PRES? How can we make it truly national? How can we get better reflections? And we've been working with the Pickett Institute, who are experts in research methodology and patient experience and feedback, to help shape what this looks like. So PRES is regionally adapted and coordinated. Our network is made up of 15 local networks. They all are delivering PRES, and they adapt the survey so it's relevant in terms of local GDPR processes or local contact information, etc. So it all has these 15 regional hubs delivering PRES. It's delivery teams in hospitals, in GP surgeries, who are disseminating PRES. So we've done a lot of work building relationships with research delivery teams, supporting them so that PRES is not an additional burden on their day-to-day work, but it's an added value piece. And so a lot of time and energy has been spent there, and we're so grateful for the time that delivery teams put into helping disseminate PRES, because without them this couldn't happen. We offer now most of our regions both paper and online versions of PRES. Paper is by far and away our most popular way of responding to PRES, but we're seeing an increase in online engagement, particularly this year with COVID. PRES takes 5 minutes to complete. It's really simple. It doesn't take long at all, and we did that purposefully because we're so aware that research participants get asked to complete so many surveys, both in hospital surveys as well as sort of quality of life surveys, etc., as part of their study. So we didn't want to add to that burden either. We wanted this to fit nicely and comfortably into the other surveys that people might be asked to complete. We asked people to give PRES at a consistent point in the research process. So ideally at the last research visit, where you can reflect back on the whole of your research experience, but that's not always possible depending on some of the studies and the way they're designed. So we try to get people to disseminate PRES at a consistent stage in the study, just so that you are looking at feedback from all participants at sort of roughly the same period in time, and it just gives you a more balanced and accurate viewpoint. We encourage people to complete it alone wherever possible, particularly not in the presence of research staff or delivery teams, just to give people the free. We complete the survey. Oh, am I still there? Yeah, there you go, back. We ask people to complete the survey only once per study per year. So if you're on more than one study, complete it multiply for every study. That's wonderful, but we try to ensure that people only complete it once for every one of those studies. And finally, one of the most important things I think is that this is not research. We have worked with the Health Research Authority to prove that this is not a research. It doesn't require external ethics. It's akin to a service audit, really, in terms of the ethics approval needed. So that's been really important to get buy-in and to drive PRES. So I'm going to quickly run through some of the results from PRES that we've had so far this year. PRES is just finished for the year 2021, so the results are literally coming in this week. So I'll talk you through a little bit through some of the data we had in quarter3, and whilst I'm sort of chatting through that, I'd love again for people to reflect on the kind of results we're getting back, and again thinking about how might you use that locally, and then I'll talk a little bit about exactly that, how have we acted on the results of PRES. So at the end of quarter3, we had over 11.5 responses to PRES, which, considering we were in the middle of a pandemic and a lot of research was paused, this is an incredible achievement. And we actually think we're going to have response rate of about 18,000, and our target for this year was 12,000. So we've done incredibly well, and research delivery teams have worked really, really hard to deliver PRES. Really the key takeaways I wanted to share with you really is you can see here, these are our highest responding studies, and I think what you can see here, there's a real focus this year on COVID and urgent public health, which is really exciting as well, because we've run research in a very different way this year to how we've done in previous years. So I think we're going to learn and get some really interesting insights we haven't seen before. We've also had about 50% of our trusts and CCGs taking part in PRES this year. That's a little bit down from normal. It's normally about 65%. So we're really, really pleased to see so many people still finding time and prioritising PRES. And you can see that this reflects results from over 456 studies. So PRES does go really, really wide. And we've seen a real increase as well in digital responses this year. So 49% is much more improved than previous years. So we're really excited to build on that for the future. This is just a quick snapshot to show you that our 15 regions are all delivering PRES, and what you can see is there's a real spectrum. This really reflects the different sizes and spread of PRES across the country, but we are getting a countrywide picture. Some areas overrepresented, perhaps more than others, but it's really, it's a really broad picture of research in England. So I just wanted to quickly show you the qualitative comments, as I said earlier, are where the real richness and meat of PRES comes from. And what was really interesting, this is a snapshot of the themes that arose for COVID vaccine studies this year. And I think what's really interesting, there's a real multitude of things here, a lot of fears and concerns about safety, concerns or a lack of understanding about changes to what visit lengths will look like, about waiting times, a lack of information about actually being in the site. So there's some real tangible things you can see here where if you're a research delivery site that you can do locally to really help improve people's experience. There's also some feedback here. If you take line 3, where it talks about the use of apps and journals, a lot of people moved to sort of remote and online practices this year, and that really confused a number of participants. The information they were receiving didn't adequately take them through how they would use these systems and processes. And I think that's really valuable information that we've been able to feed to study teams and study sponsors when they're thinking about designing studies in the future. As I think we've all probably realised now that remote studies are here to stay and are going to become a really important part of research moving forward. This slide just covers sort of more of the usual insights we see from PRES on a traditional year, and really a lot of feedback around things like the need for regular communication, the need to know who to speak to, the need for updates on studies as they go live, things that research teams sometimes just don't have capacity to do, or it's perhaps confusing whether it's the responsibility of the site team or whether the actual national team delivering the study are responsible. So these are some really important things that we know really affect people's experience of being on a research study, and we are working with and trying to look at locally and nationally about how do we feed these into our improvement programs, where do we make changes to the way that we currently conduct and deliver research. So some of the things that we do to help support with PRES is what you can see here on the left. This is an example of one of our dashboards. So a number of our local networks run dashboards for PRES, and where you can see how you're doing against other sites and what the general trends in PRES are in your region. And this has been a really valuable way of people being able to see the live results of PRES, act on them, but also to help generate a bit of competition, friendly competition between your local neighbours and competitors to help drive people distributing PRES. So it's been a real motivator to get people delivering. What also happens with the final PRES results is all of our regions produce a regional report. I should say all of the sites involved in PRES, you get your own local data back, so you will have that to work with and act on at a local level. Your region will produce one looking at the region as a whole, and that's how they will determine if there are regional projects they can collaborate with on across all the sites in each region. And we produce a national report as well, really looking at the full data spectrum and the national trends. And that gets all published on the NIHR's website. So it's something that's freely available to use, whether you took part in PRES or not. So we really want to share the learnings of what we're doing and get them out as far and wide as possible. So I just wanted to finish off really just giving you a bit of a snapshot of some of the things that we've done with the PRES results. And I use the royal we, the network as a whole, rather than necessarily my team. So you can see here, this is a lift wrap of some of the results that Mid and South Essex Hospital got from their PRES. And they've been using this as a way of advertising not only PRES to staff and to patients at the hospital, but also been using it as a way to showcase that they are a research site and encourage people to ask questions about research. So it's a really powerful tool to help engage the public about research. We also use these stats on social media. It's fantastic. We get great responses when we be able to post positive updates from PRES, and we see really great conversation around Twitter of people responding to those. As I said, PRES results also feed into continuous improvement projects, and here are two examples. Based on feedback from PRES, our teams in the Thames Valley South Midlands region have created a new service where staff who are recruiting for studies can actually do mock interviews with members of the public to try out their recruitment technique and get live feedback from members of the public about how that went for them and what they could do differently next time. So it's been a really powerful tool that's just really been helping some of the COVID studies, particularly where staff are new to recruiting for research. And in our Eastern region, they've produced a recruitment enhancement tool, which is 3 or 4 years worth of feedback from patients that have been formed into a beautiful checklist of what's important to patients, which has been provided to research delivery teams and for people designing research to really help them think about what are those patient-centric questions that need to be addressed in your research in a bid to really make research much more about people. And that, again, has been really positively received from staff. So that really is PRES in a nutshell. I hope I've been able to adequately demonstrate some of the impact it has and some of the value in terms of the insights. This is our direct contact information. So if you are interested, or have any questions, you can contact us at that email address. But really, really, thank you very much for your time, and any questions I'd love to be able to provide a response.
Lovely. Thanks very much, Andy. And we've got a few questions, so that's great. I think you've answered the questions about online and paper, and I was surprised at the balance, I suppose, between how many are using doing it with paper pre-COVID anyway, and so I don't know whether you want to say more about kind of how it's used in practice, really practically in a study. Whether that's someone giving it out at the visit and then a person completing it, and how the online version of that would play into, the study visit.
Yeah, thanks. So it's really variable, and I think that's the key thing with PRES is that we've taken a really pragmatic approach to it. So the reason paper is probably our most popular is because, it's something there that you can have in your hand and hand out and leave with somebody when they're sitting in the reception area and in chairs waiting to go into their appointment. Some places also have found that if we offered an iPad, for example, where you could complete it electronically, that actually is an infection control risk. So some sites have decided that that's outside of what they feel comfortable with from a health and safety perspective. But with our online versions, what a lot of our sites have done is actually printed up little business cards with QR codes or the link that people can take away, and have included within that the site and study ID numbers, because the one thing that we do with PRES is we try to link it back to our portfolio. So we require a site and a study ID number to be provided by staff every time they hand it out. So we've really taken a really pragmatic approach. And I think in COVID, what we've seen is that some people in a remote study, it's been part of a follow-up email, for example, just a link embedded in an email. And I know that we've got some studies coming down the pipeline where they're going to be predominantly app-based, where the survey will be built into the app. So you'll get, like, your app will message you that you're at the point in the study where we'd like you to complete the feedback survey on your experience. So it's a real multitude of different ways, and we encourage people to adapt the delivery method to suit your patients and your site as much as you can.
Yeah, great. Thanks, Andy. And then, of course, when people are completing it, as you've shown, the study team can look at the results for that study at a site, and at a health board in Wales, you'd be able to aggregate it up and also see results from other sites that are doing it in that study. So I think that answers one of the questions that was asked. But we've got a couple of other questions just about how the results are fed back to sponsors and also the people who've answered it. So how does that aggregated kind of, you said this and we did that stuff happen?
So the you said we did bit for the public is again a multitude of different approaches. So in a number of our sites, people produce literally you said we did posters that go up around the hospital sites that literally explained section by section. You said this, we did this, you said this, we've done this. Those of our sites that collect contact information, some of them will do mail outs around that as well, so that feedback goes directly to people who have said I'd love to know more. And again, we put all of these reports on our websites, and we encourage the delivery teams when anything they do locally to share that back as well. Sorry, what was the second part of the question?
Yeah, how that information may be used by sponsors.
Yeah, thank you. So interestingly, PRES until COVID was very much a reactive process. So we would do PRES over a year, we would then look at the results, and then we would respond to it afterwards. What we've done this year is we've been able to look at it live, and what the NIHR has been doing over the course of COVID has been actually a lot of very live meetings with study sponsors for really critical key studies. And so PRES has been something that's been on the agenda. So we've been able to, in a meeting, talk through PRES results directly with the study teams. Now, unfortunately, the challenge is where those requirements require an ethics change, that's not been possible necessarily to make those changes. But the study teams have all acknowledged, and actually a number of them are specifically asking us for those insights because they're really keen to feed them into future studies. So with regards to study sponsors, it may be less so that you see a live update, but they're definitely conscious of that feedback and feeding it into future studies. So it's been a sort of a future proofing, I'd like to say, for studies coming down the pipeline. Yeah,
great. Thanks so much, Andy. And we could talk about this for multiple time slots of today's programme, but we're out of time now. But just to reiterate, obviously, if people want to know more from you, you've put your contact details. If you're interested in incorporating it into your delivery process locally for a specific study to test it, we'd love you to do that. And if that's the case, get in touch with the comms team, and we'll pick up the conversation direct with you. I'm really keen to give it a go. Even if it's just one study, we can build from there. So we've seen the value, particularly in Novavax, of the participant experience feeding into the next study visits. So you're getting lots of positive comments on the chat saying really interesting, positive tool, great presentation, Andy. So there we are. Some immediate feedback, and we'll continue the conversation with you offline. Thank you.
Thank you for having me.
Yeah, thank you.